See some rain by later this afternoon, but most of the day will turn out rain-free. High at 53, cloudy and breezy tonight with some periods of rain. Temperature's not dropping too much. We'll be in the 50s most of the day.
We're live now. Morning, everybody.
Tomorrow morning,
Important show today. We're going to be talking about statin drugs, heart disease, breast cancer.
Talk loud, that is so loud.
So, sorry for the overhead sound team. Not much we can do about that in the moment. We're working on our production crew.
It warms up to 56 with some sunshine Tuesday, and then it clouds up. We could see some rain Wednesday. High 54. With WPRO's exclusive AccuWeather, I'm meteorologist Brian Thompson.
27 degrees at the weather station. I'm Doug Lizette, WPRO News. Time for Intellectual Medicine with Dr. Steve Petteruti. WPRO News Time is 8:07.
The following paid program is furnished by Dr. Steve Petteruti. It's for basic entertainment and informational purposes only, and is solely responsible for its content. It does not necessarily reflect the views of Cumulus Media. News Talk 630.
All right, you just have to talk loudly. I can hear you softly.
Presents You Got It. Listen with Dr. Petteruti. Join Dr. Petteruti as he guides people towards living the 120 lifespan while retaining youth. He'll apply logic, reason, and scientific evidence to address conditions that drain people of their joy and vitality while protecting people from the harmful aspects of conventional medicine. Now, here's Dr. Steve Petteruti.
Good morning, everybody. It's Dr. Petteruti along with Shannon here at Intellectual Medicine on WPRO. Thank you for listening. Beautiful day out there, Shannon. Today we've got some exciting topics. We're going to be talking about heart disease, hypertension. We're going to be talking about breast cancer if time permits. Did you guys know last night, or I should say last month when you went to bed, dear listeners, with a blood pressure of 132/82, you felt pretty good about yourself, right? That was a normal blood pressure a month ago, wasn't it, Shannon?
It was.
Just 1 month ago. Guess what? You woke up this morning with a new disease. They just moved the goalpost on you and changed the definition of high blood pressure. Why did they do that? And what effect is it going to have at your next office visit with your doctor? Well, we're going to talk about that, but we need to talk about it in the context of bias. Now, we all know that bias exists. It's rampant throughout society. I'd say the worst kind of biases are the ones that we ourselves don't recognize. Now, we tend to think of science as an unbiased source of information, don't we? It's scientifically proven that, bop, 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 goes the ellipse. Well, it turns out that science itself is rife with biases. And we need to be aware of it. The point here is not that science is illegitimate because it has biases. It's that we must be aware of those biases as we interpret the science. Because the biases inform not only how things are interpreted, but what things are studied. So you may be wondering, what are our biases, Shannon? Our scientific biases? I've got them. Okay, here's my biases. I'm an osteopathic family doctor by choice. And I'm that because I have a bias that the human body has enormous self-healing potential. And that if we can merely tap into that, a vast array of things that we consider drug treatment necessary become eliminated. And I'm a family doctor by bias, so therefore I'm biased. I think that the best thing we can do is to preserve our health rather than wait for it to corrode and try to salvage it later. You know, when I was a resident, Shannon, I was working at a neonatal intensive care unit down in Columbus, Georgia when I was with the Army. And I remember loving that experience. You know, it's just so intense. And at one point, my mentor looked at me and said, you know, you should consider doing this medicine. He said, you're going into regular medicine and you're working in an intensive care unit. And you do a brilliant job. And what have you added? Maybe a year, maybe 6 months to somebody's lifespan? He said, you do the right thing here. You add 80 years, 90 years. Now extrapolate that into primary care. You know, it's always exciting. I mean, isn't it exciting? Even if it's a little bit sad, it's exciting when somebody goes to the hospital, right? Uncle Fred's in the hospital. Everything stops. People rush to the hospital. They talk to the doctor at the hospital, and Uncle Fred's going to get a boppity-bop test, and he's going to get the machine that goes beep, and he's going to get the probe, and he's going to get the biopsy, and everything becomes super intense, right? Well, guess what? 20 years ago, Uncle Fred could have seen a doctor inclined toward intellectual medicine, and maybe he'd never go to the hospital. That's our goal. That's our goal. And we try to bend people that way. But we also, you know, we want to keep you guys happy. And we have a fantastic free the emphasis on free, offer today, don't we, Shan?
Oh, we do.
We do.
What are you doing today?
Well, you can. We can do this, right, Maya? We can have people call in, Tessa, if we need to. They're going to call in for a free copy of my book.
That's right, a signed copy.
A signed copy of The Cancer Machine. This is a fabulous page-turning fiction novel that I describe it as art imitating life. The story is informed by my personal experiences, and it is informed by the bias in medicine as our protagonist has to go against difficult odds. So we're going to give away 3 of those copies to the first 3 callers today during the show. You just leave the information with Tessa Maya behind the glass, and they will take down your name. You come by Intellectual Medicine in Warwick, and you will get a signed copy. How cool is that? Signed copy from yours truly. But listen, we've got to talk about this study. This is important. So statin drugs, it seems to me, Shannon, like everybody and their brother's on a statin drug.
It's a talk.
It's huge, right? Statin. How do we get to this place? How do we get to the place where, the doctors seem to be advocating these drugs so aggressively? And might they cause harm? Well, we've been noticing a trend in the literature where the statin drugs are correlating with increasing risk of diabetes. A recent study in the British Medical Journal, this is published October of 2017, showed that there was an increase in diabetes in people taking statin drugs by 30%. And that risk increased over the duration of the treatment. Does it mean that you should abandon your statin drug? I don't advise that. It does mean, however, it should be highly scrutinized. That when a doctor says to you, I want you to take this drug, you should engage in a conversation and be a little bit skeptical. How did we get this information? Why is it being advised? This is especially true, folks, if you've never had a heart attack or a stroke, if you don't have a big family history, especially true if you don't have any known heart disease or vascular disease. So you go to your doctor and you've got a cholesterol that's a little bit elevated, and they may advocate for this drug, one of these drugs. Well, you've got to be concerned. Now, in the study, there was the study that really kind of bent the arc on this and started healthy people taking statin drugs, right? This is very different if you've had a heart attack and we're trying to prevent another one. That's called secondary prevention. You've had a known event, we're trying to prevent the next one. The study that extrapolated that to otherwise healthy people was called the Jupiter study from the New England Journal of Medicine in 2008. Now listen carefully to the title of this study. Remember I talked to you about bias and biases in what we study and how we study it. Jupiter stands for the justification for use of statin in primary prevention. Right away, the title explains the bias. We're doing this study so we could justify the use of the drug. We already have a conclusion in mind. We just want to bend the information to get to that conclusion. And they took folks with a normal cholesterol, with an elevated something called a C-reactive protein, which is a measurement of inflammation. It's a blood test, and it measures general inflammation, the type you can get with an infection, the type you can get with most chronic diseases. And they took these normal, healthy people with normal cholesterols. They took 18,000 of them roughly, and they put them on a drug called rosuvastatin. The study was stopped early because the authors found, and I quote, a striking decrease in coronary heart disease and complications. Such a striking decrease that they had to stop the study ahead of its scheduled end, less than 2 years into the study, for this profound reduction of 1.2%. Stop the presses. Everybody take your rosuvastatin quick before you die of heart disease, right? So we're going to flood the market. Can you imagine what a multi-billion-dollar bonanza this would be, or is? Well, guess what? We have now scrutinized the Jupiter study, and it's beginning to break down. It turns out, follow the money, right? 9 of the 14 authors took money from AstraZeneca. AstraZeneca is the company that sponsored the study. AstraZeneca makes rosuvastatin, also known as Crestor. You think that had an influence on the outcome? One of the authors, the lead author, hold the patent for the C-reactive protein study that is now being advocated as a standard measurement for heart disease. So you connect these dots, and your poor, overburdened, rushed, and buried primary care doctor simply gets the headline promoted to him from the authors and from the specialist: put your people on statin drugs. Put them on rosuvastatin. Holy cow, what's happening to us? Is there a better way to go? Are there other healthier ways to do this? You bet there are. When we come back, we're going to talk about the disease you acquired last month that you didn't know you got and how that affects all of medicine. I'm Dr. Petteruti. You're listening to Intellectual Medicine.
Hi, this is Steve from Water Filter Company.
So crazy.
Isn't that nuts? When you hear it and you put it together, it makes you kind of like gasp a little bit. All right, so we'll come back with the hypertension piece, and then we'll tie it into the chelation therapy and the
I just
treatment
think
we
it's
do.
funny how long it took to get JNC8 out. I was in school that entire time where they're like, it's coming out, it's coming out, it's coming out.
Well, and it came out in 2014, and here we are in 2017, and there's a new standard.
That's what I'm saying, but it took like 7 years or some ridiculous amount of time
Yep.
for them to get those numbers. And the studies, proving.
I know.
And what?
You know, now they're advocating.
Oh, man.
Everybody.
My battery's going to die.
Pardon me? How's the sound, Jen, overhead? Seem better?
Better.
It's better, yeah. You're still soft, but it's better.
I need a...
I'm sorry, I don't know why that is.
All right. That was a little better. It's good.
Do you have a phone plug? My phone's going to die.
Hey, folks, we're about to lose you. We don't have enough power in the phone to last the entire show. So go to our website, Intellectual Medicine. You'll see the picture of me behind the microphone. If you click on that... Oh, wait. Oh, rescue.
Yes. Oh.
We got juice. Okay, never mind. We're going to last. But you can go to our website and you can watch the old shows, or you can re-listen to some of them so that you... You can't reach. So Shannon has the cord, and it's about 6 inches short of her target. Technology at its best.
Oh my gosh. You seen it? Oh, there's another plug.
You got one closer?
No, it's not a plug. Okay.
Our $8 price represents a 70% saving.
Why do you do it?
I know.
I'm just going to hold it. It'd be hard to talk.
Oh. Right, I'll not impose conversation on you. Closing in? Okay.
Oop.
Spices and extracts, including 70 varieties, $1 each. Holiday gift bags, large bags, $1. Small bags, 40 cents. At Job Lot, we love the change in seasons. If it helps keep you warm or get ready for the holiday season, we probably have it at the right price at Ocean State Job Lot.
Health Source RI for employers
Can't
allows
talk,
you
it's
to
working.
attract and retain top talent by offering your employees exclusive benefits. The full choice program lets you offer
Make people nauseous.
You don't have a closer plug, huh? How about this plug into my profile?
No, that's all right.
This plug doesn't work.
It's not a plug. It's like a
Oh, I see. It's a
pretend-
three-pronged thing.
It's okay. I just don't know if this one's actually working. You know what I mean?
Now back to Intellectual Medicine with Dr. Petteruti. UPRO or one
I like real music better.
PRO.
Hey guys, we are back. Dr. Petteruti here with Shannon at Intellectual Medicine. So we just left talking about bias, talking about how it affects science. I've got to express another bias I have, Shannon. I have a bias. Does anybody listening to me this morning think that we are not taxed enough? I was tying this in. We always tie this into health because that which drains our money drains our resources and affects our ability to pay for our health. Does anybody get up in Rhode Island and say, you know what? I think I need to be taxed more. Once upon a time in Rhode Island, the streets were plowed, the schools were funded, the prisoners were in prison, the fires were put out, and we did not have an income tax and we did not have a lottery income. I remember that because I was alive back then. It wasn't that long ago. Now we have both of those sources of income, and we don't have enough money. We got to go tax the truckers to pave the road. They do that, folks. It's called divide and conquer. You don't have to worry, right? I'm not a trucker. What do I care? Well, pay attention because you're next. The solution is in controlling your expense, folks. We started out this year in the state of Rhode Island with a $63 million surplus. We now have a $60 million deficit. How many people think that's great management? Well, I got to pivot. I got to go back to medicine, but I just had to get that little detail off my chest. So you woke up with a new diagnosis. I know we have a couple of callers, folks, but if you hang in there, I've got to make this point. It's too important. The committee, the American College of Cardiology, along with the American Heart Association, published a statement in this was more recent than that. This was actually this year. They redefined hypertension. The new number is now 130 over 80. That means if you've got a blood pressure of 130 over 80, you're considered by this new standard to be hypertensive. Holy cow. Where did that number come from? And what's the consequence of it? Well, the consequence is intended to try to motivate people to get healthier. But here's what really happens. 130 over 80, you go to the doctor, your blood pressure is 132 over 82, and he says, you, Shannon, you have hypertension. Stage 1 hypertension. They even give it a stage. That's all scary, right? You don't want that, so you seek a remedy. Now, most doctors, the vast majority, do not believe diet and exercise ever works, but they tell you to do that so they can punch the ticket and then give you drugs. This new definition has the potential to bias insurers against you as you get labeled hypertensive. Your life insurance is going to go up. Insurance companies will make more money. This new definition has the potential to overwhelmingly direct your doctor to prescribe drugs. What do you mean you're not treating that hypertension, Dr. Jones? Didn't you know that your patient has stage 1 hypertension and you chose not to treat it? The drug companies are smiling all the way to the bank. Hey, here's a concept. How about treating the underlying risk factors, right? How about treating obesity, reducing inflammation? So the study, this is the practical effect of it. A healthy 65-year-old man with no heart disease history, exercises every day, does not smoke, would be recommended by this new study to be put on drug therapy. And now, because you're on hypertensive drug therapy, you now have a risk factor, and based upon the Jupiter study I was telling you about, you're going to put you on a statin drug. You just went in there perfectly healthy, exercise every day, blood pressure is 134 over 82, and you walked out on 2 drugs. How did that happen? Now, we talked about biases. Here's another example, and one of the reasons why we exist in intellectual medicine. We exist in intellectual medicine because we try to highlight that which orthodox medicine might otherwise bury. So the results of the statin drug, this Jupiter study, pushed everybody to use statin drugs, right? There was another study that you probably haven't heard of. It's called the TACT trial, the Trial to Assess Chelation Therapy, TACT. That study looked at intravenous chelation in people that had heart disease to see if it would work. Now, the bias of the authors was that it was a hoax, that chelation therapy wouldn't work, that patients that were having it done were being fleeced, and they wanted to prove that the chelation therapy, this intravenous treatment of high-dose vitamins along with calcium EDTA or disodium EDTA, was ineffective because doctors like me were doing it all over the country and patients appear to be benefiting. So they were going to put an end to this folly. Well, guess what, folks? The study proved that it worked. In fact, there was an 18% reduction in events in people who received chelation. 18% reduction with no known major side effects. In addition to helping you with heart disease, oh, by the way, chelation therapy pulls out toxic heavy metals like lead. that are known to corrode your brain. So I haven't heard anything yet, Shannon, that's bad about this, right? Lower heart disease, no side effects, taking away toxic heavy metals. Sign me up for that, right? The authors concluded, quote, the evidence is not strong enough to support routine use. Not strong enough? What are you waiting for? Well, what they're waiting for is for their bias to be processed, right? Because their bias wasn't validated by the study, so the study got buried. Well, that doesn't mean we can't do it. We believe in evidence-informed medicine. Now, that's a little different from evidence-based medicine. Evidence-based means there's unequivocal proof that something works, therefore you do it. Evidence-informed means there's strong evidence of potential value, and in the absence of absolute proof and in the absence of risk, we should move forward. That's where we are with chelation therapy. I think everybody hearing my voice should be getting chelated on some level at some time to take away heavy metals and protect them. That's my opinion, evidence-informed opinion. So we move on. What else is evidence-informed? You know, Shan, there was a doctor in Virginia who had the audacity to treat patients suffering with sepsis with high-dose vitamin C. Sepsis is an overwhelming infection of the blood that can kill you. In fact, it has a very high mortality rate, and antibiotics often don't work. In his experience doing this limited exposure study, there was a profound decrease in the death rate in people receiving vitamin C. Interesting. So that was noted, and other doctors said, well, we should study this, and I think they should. But they should also start doing it today. Because what happens if they do that, when they do the study, and they find out in 5 years that vitamin C actually does reduce death? How about all those people for the past 5 years that didn't get exposed or didn't get the benefit of the treatment? It's evidence-informed to do the treatment right now. Because if you do it and you find out in 5 years it didn't work, you haven't hurt anybody. But if you fail to do it, you end up causing harm. Another study, you know, we believe in the body's self-healing, Shannon. Did you know that if you have 2 servings of nuts per week, you're going to reduce your heart disease risk 15 to 23%? Throw away the statin, pick up the peanuts. I think safer and they taste better. Well, we need evidence information in many realms of medicine. Hypertension is one of them. Be slow, people, to take the drug. Challenge the orthodoxy. Consider better alternatives. Those statin drugs that everybody likes to promote, they can decrease your risk if you have elevated blood sugar, if you're obese, if you have metabolic syndrome. These things can be treated with diet, with exercise, with intellectual medicine interventions. When we come back, I'm going to take Marilyn's call in the car. Mike in Coventry. Congratulations, Charlene. Book's coming your way. And when we come back, we will be talking at some point about breast cancer, the risk of its relapsing after 5 years when people thought they were safe. But up next from the Revolution Softwash News Center is Doug Lizette with today's headlines. Doug, what's happening out there?
Good morning, Doctor. Congressional investigators are asking.
Hey, you're so ingenious. Very clever of you to keep that alive. Shannon found a way to keep the juice flowing. We're okay there?
Three people familiar with the.
Hi. So Charlene doesn't have a question. Do you want her to stay on the line, or what do you want me to grab her?
Oh, no, yeah, you could just give her the address for the office, which is 250 Centerville Road in Warwick, Rhode Island. The office is open Monday through Friday, roughly from 9 till 5. You can give her the office number, 921-5934, just to make sure. And she could stop by any time and pick up her book. She doesn't need to stay on the line. We won't put her on air, and she'll get her signed copy.
Perfect, thank you.
They're with their mother.
The others aren't. The others have an actual question.
Yeah, Mike has a question about pain.
921-5934.
Pardon me?
921-5934.
921-5934, yes.
Okay, thanks.
Marilyn in the car has a question about acid reflux. Mike in Coventry has a question about pain. I had to take, they've been waiting for like 9 minutes, so I'm going to bring them both up and come back.
Make sure you reiterate.
I'll try to reiterate the questions, folks, so you can follow at home. drives me nuts. So when you look at the bias and the failure to embrace unorthodox treatments that have so safe and have so much potential
Well, what was that
benefits.
Crestor? 1.5%, and it was stop the study. This is amazing.
Stop the study. This is amazing.
Chelation's 18%. It's like, well, we don't know.
Why not complete the study and look for complications? You know, when you put a healthy person on a drug, you better be damn sure you're not causing them harm. You know, chelation, we know, if you go on chelation therapy, your heavy metal levels are going to go down. Your lead, your mercury, your cadmium, they're all going to go down. So the risk factor is like zero, other than time and money, which is modest. So I don't understand why anybody would resist and perceive that as a negative. The only way that could happen is if people are abandoning orthodox treatments that are known to have value. And you think, hey, I don't need to do anything. I don't need any I don't need any drug therapy because I'm in a chelate. The way it works best is when you link things together. You hungry? You want to get some food after?
No, I'm never hungry.
All right. We'll get coffee.
I'll get coffee.
Yeah.
Oh, I did have my protein bar.
Oh, good job.
I had to take Andy training.
Oh, what time is that?
It's at 10:30. I thought it was at 10:30.
Where is it?
It's at 10:30. Rick.
Rick?
It gives you the freedom to sleep in total comfort anywhere you are. Our smallest and most advanced portable design ever. Transcend is so small and so light, you can fit it in your briefcase or purse to use anywhere you go.
You can let Marilyn know she'll be our first caller after the break.
Offline. Enjoy the freedom to sleep comfortably anywhere. To receive your 10-night in-home trial, call minicpap.com now. 1-800-600-1334. Again, that's 1-800.
How much more of this training do we have coming from Andy?
Starts on Monday.
Jim starts Monday. Does he come to the house? We go to him. What time did you do it?
Like 6, I think.
So we'll all be able to partake. That's cool.
All right then. Enjoy 10 chicken nuggets for just $1.49 today. Get more your way. Only at Burger King. Limited time only. Price and participation may vary.
Not a morning person? Yeah, me neither. So I'll make this simple.
And then we have to. Do we have an appointment down on the
For sandwich.
cabinet place?
Good.
No.
Right now at Burger King, get 2 hot and flaky croissant breakfast sandwiches for just $4. That's 2 croissant for just $4 at Burger King. Piled high with crispy bacon, fluffy egg, and melted cheese. And they're 2 for $4. Hey, treat yourself. It's the morning.
Is there a question up?
Okay.
Okay.
Got a DIYer on your gift list? The Home Depot has a couple of suggestions. In one, Ryobi's One Plus drill driver and impact driver kit at a new lower price of just $99. Was
So,
$149.
folks, you're
Two great Ryobi tools,
listening at home.
battery that drives them both.
Perfect
Plus
gift would be the
over
Cancer Machine book.
Can't decide between this
Really,
two
you could just
Get
you could
this
just
tool and that.
email Shannon or
Ryobi One Plus drill
Facebook
driver
her,
and impact driver kit,
and we
just
will.
$99
You can purchase a book, and we'll have a signed copy to you or whomever you want to give it to as a gift. Talked to somebody recently, read it in 2 days, said he couldn't put it down. It really will give you a chill because it reads so true to life when you look at what can happen when orthodox medicine meets progress. You ever think like our life or profession will be in jeopardy because of what we do and talk about?
No, of course.
Of course.
I mean, you hear that.
Yeah,
Positions that just disappear. They're doing it's like forever commercials.
I know. Well, if I disappear, you got to carry on the show, Shan.
I don't think so.
You got to get the new doc who's coming
There we go.
to carry it on.
Get him to do it.
Gain practical experience with emerging technology and equipment not found in the civilian world. The Army National Guard can get you started in an array of STEM-related
Oh, it's off?
such as
You're not on the air.
communication systems,
Oh, that's right. So I can talk in here, nobody hears it.
engineers, technical engineering, air traffic control, and chemical, biological, radiological.
You feel like going to the gym today?
Get a head start on your career in an exciting
Let's see.
field while earning money to pay for college.
You're,
Okay, shouldn't stretch on air. It's tough having people like watch us during the break. I forget that we're being watched. Well, we're not really being watched. They're like doing stuff because they know we're on break. I mean, they have it on, but they're like doing stuff.
With Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
Hey everybody, we're back. I'm Dr. Petteruti, and we want to go right to Marilyn because she's been so patient. Marilyn, you're on Intellectual Medicine with Dr. Petteruti. Well, Marilyn, tell me about your daughter's heartburn. Okay. Okay. Right. All right. So the question is there an alternative to taking omeprazole every day for acid reflux? And what about the recommendation for surgery? Well, a couple, yeah. First, your point about taking it every day is valid. What we know about taking proton pump inhibitors every day is that they can increase your risk of pneumonia, sinus infection because they obliterate the acid in your gut, which is protective. They can make it harder to absorb micronutrients. And there's been a correlation with an increased risk of gastric cancers and gastrointestinal cancers. So long-term omeprazole, look, your stomach was meant to have acid in it. Now let's talk about the risk factors. The American diet is conducive to making heartburn. And a lot of the things we take for granted as conventional foods can cause harm. So the first things to address would be diet modification, elevating the head of your bed. Now, pillows do not work. You've got to put something under the headboard to get a tilt of several degrees so that the acid stays in your gut at night. Getting yourself down to the percent body fat that is ideal. Reducing percent body fat below 30% in women, 20% in men, correlates with a reduction in all causes of illness. And then finally, I have found in my practice there are people suffering with subclinical hypothyroidism, that is, the thyroid's not high enough, and it interferes with movement of the gut from the mouth to the anus and can make acid reflux more prevalent. I'll comment briefly on the surgery, Marilyn, then I got to move on because Mike's been waiting. It's called a fundal plication. It's a surgical procedure where they can tie off the esophagus and they can eliminate the reflux. It has a high degree of success. However, surgery is fraught with its own risk, everything from anesthesia to infection to blood clots, so you got to be very cautious. The other thing, you can't vomit after they do that surgery, at least it's really hard to, and that can present a problem later in life. So a young woman with acid reflux, I would address all these other variables aggressively before going forward. Marilyn, thanks for calling, but I'm gonna shift over to Mike. Yeah, Mike, good morning, and thank you for being so patient. You're on Intellectual Medicine with Dr. Petteruti. What's on your mind, Mike? Right. Right. Now, Mike, you're bringing up great points. So you've not had a heart attack or a stroke, am I right? Okay, so otherwise healthy. Your doctor put you on a statin drug because your cholesterol was high. Is that about it? Okay. And subsequently, you developed this muscle aching. I got to tell you, Mike, we see that often. And it's one of the reasons why I think you should be very, very cautious about moving forward on statin drugs. Taking it every other day is not known to have any benefit. Hell, taking it every day is not known to have much benefit for an otherwise healthy man. And I would look at other triggers because I have seen patients will time their muscle aching to the statin drug cycle. And that's not been fully validated in research, but there's enough clinical experience where that may be the case. And we know that statin drugs increase diabetes risk. So dial it back and look at what are the causes of the pain, where's the source of inflammation, and how can it be modified? Are there things that can be done to look at risk factor besides just treating a number, which is what we do with cholesterol drugs? I would ask about, and this is for all listeners, something called a calcium score, which can look for plaque in the arteries without invasiveness, and something called a pulse wave velocity test. So you can better gauge your risk before you continue with the drug. Well, Mike, good luck with that, and I think you should have that conversation with your doc and really scrutinize the statin drug. But I do need to move on. I do have Liz has been waiting. Liz, you're on air with Dr. Petteruti at Intellectual Medicine. Good morning, Liz. What's happening? Yep. Liz, I'm losing contact with you, but I do want to amplify your point. Liz is a healthcare provider. She made excellent points about these new recommendations for blood pressure. What about somebody who's otherwise healthy? You put them on a blood pressure drug and they pass out, or they fall and they break a wrist or a hip, or they cut their head. We've seen this happen. Healthcare providers like Liz have seen this occur. The recommendation was global, and it was really blunt, 130/80 for everybody. It's incumbent upon your doctor and you to peel back the layer and look into that more closely. Be a little skeptical and ask good questions. Are there alternatives? Do I really need this drug? Particularly, folks, if you're older. If you're over 50, blood pressure of 130/80 may be perfectly great for you. But next up, we've got, it's Nancy from Cumberland. Good morning, Nancy. You're on Intellectual Medicine with Dr. Petteruti. Hi, Nancy. Good morning, Nancy. How can I help you? Yeah. All right. Let me jump to my thought on that, Nancy, because I'm up against the clock here. The question is, what about this ear pain? Most people go right to the thought, gee, I must have an ear infection, and that is possible, but often overlooked is temporal mandibular joint issues, clenching teeth at night, and that can create pain that refers to the ear. That can be evaluated by your doctor by analyzing where the TMJ joint is and seeing if the pain correlates with it. Well, good luck with ear pain. That is a big nuisance if you've ever had it, folks. I'll be back after this break, and I will be talking about the breast cancer risk and taking one more call from Bill in Providence because he's been waiting. You're listening to Dr. Petteruti at Intellectual Medicine. See you after the break. So we're going to take Bill, and then that's all the calls we'll take.
My hand is so shaky.
Yeah, I won't have time to field two calls and talk about the topic that I want to engage. Okay. Yeah, I want to get to that breast cancer information.
Yeah.
Oh no. Can't find my glasses.
Wow, huh? I feel like a big blue bug guy all of a sudden.
Time to finally get
Tony.
Tony to Jesus. How did I do reiterating?
Good.
Okay. I'll get my critique.
Well, I know, I thought it was good.
Yeah.
It's helpful that I don't have earphones on.
Oh, really? Oh, because you experience it the way they do.
Mm-hmm.
Yeah.
It gets to a point where it's like...
Oh, because there's dead space, yeah. Yeah, I think that when people pivot into product promotion, we cut it off. I don't want to use this as a platform for other people to advocate for fill in the blank, whatever multi-level marketing thing they're pushing that week.
No.
Running encryption packet alpha 990. I don't feel so good.
What is it, computer?
Is it hot in here? It feels hot in here. I feel a little clammy. I should lie down or
Computer virus.
A computer.
Oh, that's what it
is. Surprising.
That's funny.
What's
I
not
just think it's
surprising?
funny.
How much you
See, they have a robot now that can do a
Those
backflip.
oysters Rockefeller were a mistake.
No.
Geico.
Yeah.
Why?
Well, it's about. Well, I mean, it's demonstrating the capacity of a robot to perform human-like activities, and the goal is obviously to have a robot like Data on Star Trek. A humanoid robot that can move and has digital dexterity and can perform tasks. How terrifying it'll be for line workers. Can you imagine if you're a foot press operator somewhere?
Line workers, pilots. Think of like all these,
Would you feel comfortable with a robot at the wheel?
No. I mean, they're programmed to, they have every program. This happens, I do this. This happens, I do this.
Sully landing on the river.
Probably would have known. It wouldn't have had that, what do they call it, the human factor?
Human factor.
The 30 seconds,
hesitation.
so it just knows. It's a computer. No, that'd be very sad, though.
If they do that, then they can't put humans in the cockpit because they'll end up being a liability.
Right.
Because they won't pay attention. And then a crisis will happen. And they'll
Or the
think,
human will override the robot, and then,
That's what they found in driverless cars. Whenever the human overrode the computer, it was the wrong decision and created an accident. For instance, a car was coming up on another one, and the human thought that a rear-end collision was about to occur, and that they weren't braking hard enough. The computer had calculated like the perfect braking. The human jammed the brakes, and the guy behind him rammed them. Whereas had he done nothing, it would have just stopped before the collision. Maybe avoiding another collision. I don't know. Would you ever go to a computer doctor?
No.
Hello, Shannon. Tell me your symptoms.
Yeah, they'd chart at the same time. There'd be no charting. They do it in their head. Right?
I am programmed for perfect diagnosis 100% of the time. If I tell you something, it must be true.
I'm uploaded with the latest studies.
Yeah. My program was paid for by AstraZeneca.
Who built me?
That's PlaytimePharmacy.com or call 855-301-9565. Visit PlaytimePharmacy.com or call 855-301-9565. Now, back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
We are back. I'm Dr. Petteruti, and this is Intellectual Medicine. Shannon, I think it's only fair to our listeners that we disclose all of our sponsors.
We should. Ready?
Because we know that can affect bias, right?
It does.
All right, so get out your pencil, everybody. Get out your pencil. Write these down. Ready, Shannon? You go. You go first.
No one.
No one.
No one. I got no one.
You got nothing.
You?
I thought you were working on that.
I'm trying every week. Listen, if anyone wants to be our sponsor, we'll take
right.
your call.
AstraZeneca, I will take everything back I said about you for a cool million.
Maybe we can be bought, right? There's always
I don't know.
a price.
Who's got their price? No, we can't be bought. Damn it, we are too true and pure. All right. Well, listen, I'm going to take a call from Bill and talk about breast cancer next. Very important information. Good morning, Billy. You're on Intellectual Medicine with Dr. Petteruti and Shannon. How can I help you? Yeah. Hey, Billy, I want you to bring your question to the front, though. What about that sequence? It's a tragic sequence. I'm so sorry for your loss. So your girlfriend had a history of congestive heart failure and developed a cough and subsequently died from massive pulmonary hemorrhage and respiratory arrest. Yeah. What's your question regarding that sequence, Billy? Mm-hmm. So the question is, would you have a better chance of surviving that episode in the hospital versus at home? And yeah, well, to answer your question about the location, some of these acute events happen so suddenly that you don't have the benefit of being taken to hospital in adequate time. There's something in emergency medicine called the golden hour. When bad things happen, immediacy is important. But if your heart stops or if your lungs stop for any reason, you're talking minutes. And often, even in the hospital, when that occurs, Billy, it's just God's way of taking you home. Even with the best care, with the best doctors in the most intensive setting. The causes of pulmonary hemorrhage are varied. It can happen from, in cases of cancer, from the malignancy eroding into an artery. In cases of chronic lung disease, there can be loss of elasticity of the tissue, making it more friable or easier to break. Think of a rubber band left out in the sun, losing its bounciness. That's part of what can happen with chronic lung disease. And then combining that with heart failure puts back pressure on those arteries. So sadly, we'll never know the exact cause for your girlfriend's demise. But fortunately, she's that type of an exit is horrible to witness. But to the best of our observation, seems quick and fairly painless, my friend. Listen, I'm sorry for your loss, but I do want to talk about breast cancer next. This is important information, and we're talking about life and death. Our caller Billy just had to experience a horrible loss. And Shannon, sometimes I think medicine is a victim of its own success. You go to the hospital and you expect everybody to come out alive, and that's the goal, obviously. But we've got to start way back, folks, early on, right? You avoid chronic lung disease. Chronic lung disease is often a consequence of toxic exposures. At some show, Shannon, we need to talk about vaping and about all these kids getting hooked on nicotine and, unbeknownst to them, what's going to happen next. Are they going to be the next wave of people with these complications? But breast cancer risk. So this is very compelling. Breast cancer, one of the most tragic forms of cancer because it strikes women in their prime. And it imposes incredible hardship on them, both in its treatment and of the consequences psychologically and physically. One of the concerns has been for a long time delayed relapse, delayed recurrence, or distant metastases. So you have breast cancer, let's say it's stage 1 with no lymph nodes involved. It's surgically removed. The standard of care would be to put many people, on a drug to block estrogen levels to help reduce the risk of recurrence. Current standard is for that drug to be used for approximately 5 years. Now, there are consequences to that drug. You block estrogen, you tend to wither your bone. You have vaginal atrophy. You have problems with sexual function and libido. It is not a pleasant experience, particularly for these young women. Well, for any woman. And then after 5 years, they take you off it, and you've kind of made it through that golden window. But recurrence rates, based upon New England Journal of Medicine, recently published article, 13% for delayed distant metastases. You think you're in the clear, and then it's 8, 9, 10, 15 years later, and here it comes again, only with a vengeance as it hits other organs. If you have a breast cancer with 1 to 3 lymph nodes, the delayed recurrence goes up to 20%. The range for all women with breast cancer is anywhere from 10 to 41% risk of a distant metastatic recurrence. The cancer is gone from the breast, but it shows up in the bone, in the brain, and another organ, usually in a very aggressive form that's hard to treat. Well, doctors are contemplating this and wondering, what can we do? How do we lower those rates? And the current thought is, maybe we should extend the hormone therapy. It's a reasonable thought, but it comes at a price. And the price is all the adverse consequences of blunting estrogen in young, healthy women. Are we going to beget more death from fractured hips than death that we save? The study to prove whether or not that's worth doing is almost impossible to do. You'd have to take tens of thousands of women and follow them for 20 years. One group on drug, one group off drug. Yet we need to make decisions. This is the realm of evidence-informed medicine. Not everything can be thoroughly studied. Now, I have theorized, and I've offered this opinion on this show, and I've offered it to my colleagues, both in oncology field and in the intravenous vitamin C field. We at Intellectual Medicine firmly believe in secondary prevention for all forms of cancer. This is not evidence-based, that is, it's not proven, but it's evidence-informed. Where do we start? Well, how about instead of taking all those drugs, you get the percent body fat below 30? Any woman that's ever had breast cancer needs to address this aggressively, in our opinion, because it is a known risk factor, previously identified. And guess what, folks? There's no harm in treating it properly. The problem is doctors in orthodox medicine do not know how to treat obesity. Intellectual medicine has solved this problem. We have success every day, every week. Our success rate's over 90%. You need to know that because you don't have to get surgery for gastric bypass. And soon, we'll have the Intellectual Medicine Center available in East Bay. The renovations are rapidly taking place, and we're getting ready to introduce the doctor and launch that center in the weeks to come. So this will be even more available. What other things can be done? Modest exercise has benefit. How about the role of intravenous vitamin C and other supplements, safe, natural vitamin supplements that can have benefit, potential benefit, when it comes to reducing that risk? Now, I want to emphasize this is evidence-informed, not proven. There is evidence showing activity of high-dose intravenous vitamin C against many forms of cancer. What if you took somebody who once had cancer and instead of waiting to see if it comes back, you took secondary prevention, including intravenous vitamin C? Now, we theorize that doing it once per month has strong potential to be killing cancer cells that are trying to reform in the body before they have a chance to gain a head of steam. We are advocating that because of its safety, not going to hurt anybody, its low cost, and its practicality. It is evidence-informed, and I cannot tell you for sure that it'll work, but I know it's going to cause no harm, and we can look back over time and look at that, right? If you've had cancer, and, Shannon, you've lived this experience.
Yeah, every month. I do it every month.
After the melanoma, they say, good luck, right? We hope it doesn't come back. We hope it doesn't hit your brain. But we got nothing to offer you other than hope and repeat CAT scans. We need better. And this breast cancer study starts to expand our thought about cancer as a chronic recurring illness that can be helped with secondary prevention. Our theme song here, Shannon, it's Everyday People, and it's for a purpose, because we believe in intellectual medicine for everyday people. Anti-aging, life extension is not for the rich and famous anymore, folks. It's for all of us. We can all live our youngest life, our best life every day. So for Intellectual Medicine and Shannon and WPRO, I'm Dr. Petteruti wishing you 120 youthful years.